Today I'm going to talk to you about how we evaluate a patient with pain. We're going to differentiate between acute pain and chronic pain. And then at the end, we're going to talk about the implications of this and the best way to manage it. So if this is of interest to you, go ahead and stick around and hopefully you'll find it educational. So when we evaluate somebody, the first thing we want to know, is this an acute pain situation or a chronic pain? So something we see very often is disc herniation. So a person's bending over to pick up a pencil, they get a sudden shot down the leg, into the calf, then goes into their big toe, and they have trouble raising their foot. It's very focal. They describe it as searing and intense. They know exactly when it started and where it's going. That's called an acute pain situation. In this situation, we're going to be very aggressive about controlling that pain quickly. We're going to probably ramp you up on some high-dose anti-inflammatories. We'll include some neuroleptic medication, likely do some sort of injection if the image supports it. And then you may benefit from a short course of some higher intensity medications, but not for the long term. Contrast that with a chronic pain situation. This is also something we see. So with age-related changes, and by that I mean above 40, you can get some settling of the disc, you can get enlargement of the joints, and you can get general tightening of your spine so that certain movements irritate those nerve roots, and those patients will have bouts of pain and then relief and pain and relief. They'll get some imaging and there's nothing very distinct besides general degenerative changes, but then all of a sudden their pain will get out of control and their doctor will say, well, your imaging hasn't changed. I don't know what's going on here. So what's happening is that acute pain is now developing into chronic pain. And there's different ways to treat that. The things that we'll focus on are, one, how do we prevent this nerve root or these nerve roots from getting irritated? Is there something you're doing in your daily activity that we can modify? Next, we're going to focus on medications called like neuroleptics or tricyclic antidepressants, which are aimed at nerve pain, chronic pain, as opposed to high-dose anti-inflammatories. And then the last thing is we're not going to want to put you on high-dose or long-term narcotics because those don't provide long-term relief and they're likely to make you worse. We also may consider some injection therapy or ablation therapy that can be significantly beneficial, but there's definitely two different ways to manage this issue. So why is this important to you? If you're somebody like the latter or the first one's obvious. You don't need a recommendation to see somebody because you're a 10 out of 10. But the second person, if you're noticing that you're having these bouts of on and off symptoms, people keep telling you they don't know why it's happening, but it's getting worse, it's beneficial to see a pain physician because we can evaluate your situation, we can explain what's causing it, you can modify your activity to not exacerbate the situation, and then we can manage you in a way that we keep you as functional and as fit as possible without restricting your overall activity. So hopefully you find that useful. If you did, click the follow link below. Our goal on this channel is to help people stay fit and active and maintain chronic injuries late into their adult life so that they have the most functional life they possibly can. Thank you.